4 years after the COVID-19 pandemic brought the world to a virtual standstill, a new disease is on the rise in Africa, one which has the World Health Organization concerned. A new variant of the Mpox viral disease is on the rise in Africa, due to which the WHO has declared a global public health emergency of international concern. This is its highest level of alert. It is the second time in 2 years that the organization has issued the alert for the disease. Mpox cases have been found in at least 13 African countries, and its new form is spreading. Through this level of alert, the WHO aims to accelerate research, funding, and international public health measures, as well as cooperation to contain the disease. But why exactly is Mpox an emergency again? You see, 2 years ago, the WHO declared Mpox an emergency when a form of the disease began to spread globally, largely among men who have sex with men. That outbreak was brought under control after behavior change and safe sex practices. Plus, the help of vaccines basically helped the people at risk protect themselves in many countries. But Mpox has been a public health problem in many parts of Africa for decades. The first ever human case was in Congo in the year 1970, and the country has seen outbreaks ever since. The current outbreak is Congo's worst ever. The country has seen 27,000 cases and more than 1,100 deaths since January last year. That has been largely among children, by the way. The disease causes flu-like symptoms and pus-filled lesions. It is usually mild but can kill. Children, pregnant women, and people with weakened immune systems like those with HIV are all at higher risk of complications. Now, currently, 2 strains of Mpox are spreading in the country. The endemic form of the virus, as well as a new offshoot. This new form of the virus has triggered global concern. It's because it seems to be spreading quickly, and little is known about it. It is transmitting through sexual contact as well as other close contact, like among children in displacement camps. The disease has now moved from eastern Congo to Rwanda, Uganda, Burundi, Kenya. So what comes next? Scientists hope that the emergency declarations will speed up efforts to get more medical tools and funding to help the authorities in Congo tackle the outbreak. Better surveillance is needed to study the virus and help stop the spread. Several challenges exist, like vaccine inequities. In the year 2022, a WHO appeal for $34 million funding to fight Mpox got no take-up from donors, and there was huge inequity in who had access to vaccine doses. African countries had no access to the 2 shots used in the global outbreak. 2 years later, that remains the case. Although there are efforts to change that, the WHO has appealed for dose donations from countries with stockpiles. The Africa CDC has also said it has a plan to secure doses, but stocks currently are limited. Which brings us to the big question. How worried should you be? Mpox is a significant health problem. It is killing some of the most vulnerable people in the world. It is possibly spreading in new ways and in new parts of Africa. But it's not COVID-19. So far, there is no evidence that it spreads through the air easily like COVID-19. But there are tools that are proven to work to stop the spread as well. The challenge, however, now is to make sure those tools actually reach those who need them the most. That is Congo and the neighboring countries.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.